from them crashing to the floor. If we've not already called 911 or called a code, now is the time to do so. Once they're on the floor, we go straight into our chest compressions. You may notice that we have actually put on gloves because I know I'm going to be trying to pull an object out of the mouth if I've actually gotten one up and into the mouth. So it's a good time to put your gloves on if you haven't already and have a CPR shield available and ready to use with a one-way valve. Keep a note here that when we do these chest thrusts or chest compressions, we're going to be going to a depth of 2 to 2.4 inches deep, and we're going to do it at a rate between 100 and 120 times per minute. We're going to give our first 30 chest compressions, elbows locked, leaning over the victim's chest, using our upper body weight to do the chest compression. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 25, 26, 27, 28, 29, 30. After my 30 chest compressions, I head tilt chin lift, I open up the mouth. I look in the oral cavity to see if I've gotten anything up out of the airway. I don't see anything, so I'm not going to do a blind finger sweep. I cover their nose and mouth with my CPR shield and I attempt a rescue breath. I try the breath, nothing goes in, no chest rise and fall. I reposition their head and neck and try again. No breath goes in, no chest rise and fall. So I continue with another 30 compressions at the same depth, at the same rate. After these 30 compressions, I go back, I look in the mouth, but this time I see something. So I reach in, I pull the object out, and I attempt a rescue breath. Let's see if we're successful. First breath goes in. Second breath goes in. If the patient is not breathing normally at this point, not responsive, I go straight into my next 30 compressions. If the patient remains unresponsive, not breathing normally, I'm going to do 30 compressions followed by 2 rescue breaths, and I'm going to keep doing this 30 compressions to 2 rescue breaths until EMS arrives, help arrives, an AED arrives, or the victim becomes responsive and begins breathing normally on their own.